Thank you so much for that introduction, Fiona, and good evening, everyone. Welcome to the Smartee International Academy webinar. It is truly an honor to be invited as speaker for tonight and to engage with doctors from around the globe to learn about Smartee's innovative technology. Well, at the end of this lecture, you will be able to understand the correct treatment procedure and techniques using the unique qualities and features of the Smartee clear aligner system. Before we begin, let me first introduce myself. Let me share my screen here. So I am a graduate of Central Escolar University in the Philippines. I graduated in year 2000, and I built my own clinic thereafter. I am now sharing it with my husband. I shifted to a corporate job in 2010 or 2010. I was a risk management analyst before I went to Singapore to work as dental support officer at DP Dental. My work experience and trainings brought me to my current job as a professional affairs specialist at Tesco Dental and the course director for Smartee Clear Aligners. Now, we will be talking about the fundamentals and biomechanics of Smartee Clear Aligner system. What are clear aligners? So clear aligners are transparent, flexible, plastic form of orthodontic devices that fit tightly over the teeth to reposition and correct the misalignment. And each appliance moves the teeth at a certain position, moving on to the next in the series until the target position is achieved, and it is a series of customized trays. What is the difference between the metal braces and the invisible aligner? For the appearance, the clear aligners are a food-grade plastic. For Smartee, it is a polyethylene terephthalate glycomodified clear aligner material, whereas metal braces, you can visibly see it. For the application method, aligners can be removed, and it has to be worn for at least 20 to 22 hours a day. Whereas metal braces, it is fixed and you have to wear it 24/7. For oral care, generally, it's good for oral hygiene because you can remove the aligners and clean your teeth. You can even floss the teeth after removing the aligner. Whereas for metal braces, it may require special brushes and flossing techniques for the patient to clean their teeth. As for the appointment, the frequency is less or shorter for invisible aligners, as well as the duration of the appointment compared to the metal braces. Now, here are the advantages of the clear aligners. It's an invisible treatment, so there's making it. It is the ability for patients to straighten their teeth without making it obvious that they are doing so. Clear aligners are essentially invisible while they are being burned. As for the maintenance, it's easy maintenance for the patient as they can remove the aligners to clean their teeth, thereby making it easy to clean and floss their teeth as well, and it lessens the chances for them to have gingivitis or periodontitis. It is more comfortable as they don't have any metal brackets or wires on, so it's very comfortable for the patient to wear. And there's no diet restriction as they are able to eat anything that they want. They can just easily remove the aligners, and they don't have worries about getting food stuck in them. So it is foodie friendly. And it also can do fast treatment result for a better smile because they use the AI technology or artificial intelligence to move the teeth using the animation. Now, first is we need to understand the product that we are using for our patient. Smartee has been founded in 2004. And back in 2010, they have two plants where they manufacture and produce Smartee, that is in Shanghai plant and in Jiaxing plant. Now, in 2015, they partnered with a Cavo group and started with their Aaron financing. In 2017, they developed the S1 to S4 technology, and that is called the Smartee Solutions, which we will be discussing later on. And they leveled up to B-round financing after, wherein it's semi-automatic production. Now, in 2018, they developed the S5 to S7 technology with a new manufacturing plant in China Dental Valley. 2019 was a breakthrough for Smartee because on that year, Professor Shen Gang and his orthodontic team developed the S8 and S11 solution. S8 is the mandibular advancement device incorporated into the aligner. S11 is the palatal device, which later on we will be discussing as well. On that year, they leveled up to C-round financing, and the China Space was their strategic partner. Now, in 2020 to 22, they developed to S19 technology, wherein they developed the multi-layer sheets and have received the Disney IP authorization and leveled up to D-round financing. Now, 2023, they were able to develop up to S20 technology already. Now, this is the Disney IP authorization that they have received from Smartee and a Series D funding of $80 million US. Now, these are the plants where they produce and manufacture Smartee in Xi'an plant and Jiaxing plant. They also produce their own sheet. So they have a plant, a fully automated aligner sheets production plant. And it's robotic technology, so everything is fully automated. As of this year, around 45 million sets of aligners have been produced, with 64,000 plus doctors who have Smartee accounts and 930 plus perfect smiles, with 695 plus patents. These are the certificates and honors that they have received from Smartee. 695 patents, with joint research and development with world-class universities such as University of North Carolina and the University of Sydney. They are also the first batch of biomechanics lab in China. Now, like what I have mentioned, they are now multi-layer sheet. But back in 2004, they have imported sheets from different countries, tried many imported sheets, brand A, brand ES. But in 2016, because they are innovating their technology, they have decided to establish their own material system, which is a combination of the crystal and diamond materials into a single layer sheet. And now in 2020, they have innovated to initiate the multi-layer sheet, which is the Diamond 2. Before they have released it, they checked its combination of the soft and hard material for better consistent orthodontic force. And they have compared it with the other materials that they have used for material stiffness, the orthodontic force, and the fracture resistance. It also went through a mechanical property testing of sheets as well. Now, for each aligners, that is called staging, meaning to say that for every aligner that the patient wears, they have to make sure that the movement is full for that stage before they move on to the next. And they are using the 6-axis force transducer for precise measurement of the aligner force and torque in 3 dimensions to assist in aligner staging. So everything is measured whenever we do teeth movement for the patients. Again, the material is a food-grade material. It's a PETG material that is promising material for all orthodontists. Smartee has different product options for your patients to choose from. The GE is the basic product of Smartee, and they have developed also the Smartee Alpha, daytime and nighttime aligners, the GS with mandibular relocation system, the Smartee Teen, and the Smartee Kinder. Now, under the basic product of Smartee, which is Smartee GE, you have product options of Mini for ultra-mild cases, Light for mild case complexities, Express for moderate case complexities, and Infinity for complex cases. If you will notice, each one of these products have refinement. Now, refinement is being used if, for example, the aligners are no longer fitting because of many reasons. One is patient compliance. For example, the patient is not compliant in wearing it, and suddenly the aligners are no longer fitting. So the doctor will have to use the refinement, and Smartee will produce new sets of aligners so that we will be able to reach our target. And they have developed the Smartee Alpha because recent studies have shown that there is a correlation between the growth and remodeling of the condyles with the human circadian rhythm or pattern of each individual. There is also studies that shows there is a correlation between the orthodontic pain with the human circadian rhythm treatment, human circadian rhythm pattern. That's why Smartee came up with a treatment plan to ensure that there is compensation during nighttime whenever there's teeth movement, which makes it 50% faster result for all our patients. So they also have incorporated the innovative Smartee S11 and S15 technology, palatal device, and the Smartee Hook traction device. The third product that they have is the Smartee GS, which is the mandibular relocation system. So it reduces or avoids tooth extraction and surgery. If we need to improve on the facial profile and correct the teeth simultaneously, we will be using this mandibular repositioning technology, or the Smartee GS. We will be advancing the mandible forward to achieve that. Smartee Kinder and Smartee Teen, we also have these two other products specifically for our pediatric patients and for our teenager patients. So here are the unique features of Smartee. They use the Smartee Check software to produce the animation. They also have the iFast, or the root visualization, the Ceph measurement, and the Smartee Doctor app. Now, they created the solution, S1 up to S20 solutions, to move the teeth. Now, we also need to understand how the teeth moves whenever we submit a case to Smartee. They also have the medical team, 400 plus highly trained smile designers with degree in stomatology, and their material has been developed for years and proved by 700,000 plus treatments, fully automated production. So this is the digital workflow for Smartee. Again, they use a Smartee Check. When we submit a case, we need to collect data from our patient. And later, I will be discussing with you what are the things that we need to start before doing the treatment for Smartee. So they use this Smartee Check to produce the animation. And you can also do the 3D controls to modify the animation. If ever that you are not satisfied with the animation that they have released, or you need to modify the treatment plan, then you can use this 3D control. You can also make use of this root visualization. For animation, you have to review it, and then you can also visualize it by using this root visualization feature of Smartee. They also have this iFast, or AI outcome simulation. You can just submit an STL file, and they will be producing the before and after result even before you send them your x-rays or the photos of the patient. And they also have this outcome pre-refinement evaluator. In the event that you will be submitting a case for refinement, you will see the movement completion ratio. And you will also be able to see the movement in opposite direction to plan per tooth, as well as the movement that are not tracking clinically to the plan. And one of the features also is the cephalometric radiograph measurement. So if you will be submitting a cephalometric x-ray, you will be able to see the measurement. And you can also put on the photo of the patient for comparison. Apart from that, they also have the Smartee Doctor app. So with this, even though that you are not in your laptop or you are not in the clinic to view the animation of your patient, you can view them using your phone, and you can also submit a case using the Smartee Doctor app. Now, what's unique with Smartee is that they have a medical team. Once we submit a case to them, the medical team will also check on our treatment plan, and they will help our smile designers who are highly trained with degree in stomatology. Now, apart from the unique medical team led by Dr. Wu Gang, we also have a separate R&D team for the Smartee GS, and that's led by Professor Shen Gang and his orthodontic team. We also have a separate R&D team for the Smartee Kinder and the Smartee Teen. Now, here's the Smartee solution. So you may be wondering, how can this clear plastic aligner work and move teeth? Now, Smartee designed the Smartee solutions S1 to S20 specifically for the products that they have. Now, we've mentioned about the basic product of Smartee, which is the Smartee GE. It can do S1 up to S7 Smartee solution. So S7 is the classic molar distalization protocol, and they are using what we call a sub-step retraction. Now, with this technology, if we are distalizing a tooth, we are making sure that there's enough anchorage in the movement. Once the canine moves at a certain distance, then only will the anteriors begin to move, and they move alternately. So it's not a simultaneous movement that they do. Now for the S6 or classic tooth extraction protocol, yes, tooth extraction cases can be done using Smartee. For S5 intelligent rotation center, yeah, that is a unique feature of Smartee, wherein they ensure that whenever you move teeth, especially for thin labial bone, there is no risk with fenestration or bone cracking. And that also will make sure that there is root control movement. Intelligent power arm and TAD or mini screw for S4, that is specifically for tooth extraction cases. And it makes sure that whenever you move teeth, there is anchorage and the inclination initially should still be upright whenever we move teeth. Now for intelligent traction, Smartee also has that feature. What they will do is that there's a reserve cut for the button for you to place, as well as a precision cut for you to hook on the elastics for traction. S2 invisible lip bumper is one unique feature also of Smartee, wherein through this appliance, it provides the lip muscle to produce the pressure that is being transmitted to the posterior area to strengthen the anchorage, especially during distalization. Now, for the classic attachment system, S1, there is what we call the iris attachment, that is for intruding the lower and anterior teeth, and the precision control, that is for root control and precision. Now, the difference between the Smartee GE from the Smartee Alpha is that Smartee Alpha also has S1 to S7 technology, but they have incorporated the S11 palatal device, the clear arch expander or the clear Nance and transpalatal arch device, as well as the S15 Smartee Hook traction device. So the Smartee Hook traction device provides traction in all kinds of traction can be used using the Smartee Hook traction device. It also has the Smartee button so that you don't have to place a separate button for traction, especially for S3. Now, the GS can do all of these from S1 up to S17. It has the device for mandibular advancement. SGTB is the sagittal twin block. SGHB is the one with the interlocking device. Now, SGTB is for those patients with prominent bone, with protrusion, as well as mandibular retraction, class 2 skeletal cases, and it provides, those are indicated for deep curve of SPE, deep overjet, and deep overbite. Whereas for SGHB, that is for deep overjet with shallow overbite and shallow curve of SPE. Now for S9 mandibular repositioning device with bite plane, those are anatomical and non-anatomical bite plane, and that is to correct the anterior deep bite or posterior scissors bite. For mandibular repositioning device with occlusal flint, there are devices or the blocks are placed on the posterior, the upper maxillary posterior teeth. And that is to treat the functional crossbite and mandibular deviation. Now, S11 again is the palatal device for expanding the maxillary arch. They also have this clear Nance and TPA rods, cortical rods, to assist in anchorage during distalization. The hybrid therapy S12 is the one with the integration of fixed braces or for segmental arch. S15, again, is the Smartee Hook traction device. S16 is the invisible forward traction device. S16 is the occlusal pad appliance with a Smartee Hook that can be used as invisible maxillary protraction with face mask. Now, S17 is the active mandibular positioning retainer that is used after you do your mandibular repositioning treatment. So this is the Smartee button. They already have integrated the button onto the aligner itself, so you don't have to put a separate button on it. For the Smartee Hook, it can support traction forces in all directions. It has 3,000 grams maximum tractive force, applicable for traction of all indications, whether it be a class 1 elastics, class 2 elastics, class 3, and interactive elastics. As for the solution for K1 to 5, the kinder, they have the optimized attachment, the tongue protrusion and tongue crib, the teeth trainer, and the bitey. So it's a different Smartee solution for kids or for pediatric patients. So as we can see, summary, Smartee GS can do all of these technologies. Smartee Alpha can do S1 to S7, including the S11 and S15. As for the Smartee GE, it can do S1 to S7 technology. So this is how the teeth moves using Smartee. Now, Smartee is also high in academic marketing. So as you can see, they have been doing lectures in different countries as well as in China, not only in China. They are holding different conferences in China. And that is why in the Philippines, we also do trainings for our Smartee providers. Now, how do we start using Smartee? Of course, if we see the indications for our patient that they need Smartee, then we have to evaluate what is it that the patient needs. Is it just to close the space? Is it to correct the crossbite, correct the edge-to-edge occlusion? Because the doctors will need to choose which package is suitable for his or her patient. And if you are a new Smartee provider or a newbie with clear aligner treatment, we recommend for you to start from mild before jumping to complex or super complex cases. Again, for Smartee GE Lite, it comes in 20 stages or up to 20 stages. It is to correct minor orthodontic issues such as the small misalignment or rotation, mild moderate crowding or spacing, and the treatment usually finishes within 6 months. Smartee GE Express is up to 35 stages. It can correct moderate number of conditions, including the severe crowding and closing large spaces, crossbite corrections, improving the tipped and rotated teeth, posterior teeth distalization and initialization. For the Smartee GE Infinity, that's unlimited stages to correct or treat moderate to severe class 2 and class 3 occlusion. It may require for you to use auxiliaries such as placing elastics or segmented arch, palatal expanders. These are for complex cases. Now we need these data to collect from our patient. First is the STL file, and then the 5 intraoral photos, the 3 facial photos, the panoramic X-ray, and the cephalometric X-ray. Now for the STL file, there are 2 ways on how to obtain them. It's either through direct intraoral scanning of the data. Now what's good with Smartee is that they are not tied up to a particular scanner. So any scanner of your choice will do as long as it can export an STL file. Now, if you don't have an intraoral scanner, you just have to take an impression, a 2-step technique PVS impression, using a disposable tray or a stainless steel tray. So do not use aluminum tray. Make sure that you cover all the teeth, all the dentition, and the gingival edge should be clear and intact. If there is a 3rd molar, you cover at least half of the crown starting from the mesial side. And the crown anatomy should be clear. And then you can pour that with a plaster mold, and then the teeth can be scanned from the model. Now, the second data are the 5 intraoral photos. Make sure that you use a cheek retractor to see the 1st molar or the molar relationship as well as the canine relationship. So you have to take the intraoral left, the intraoral frontal, intraoral right, the lower and the upper using the intraoral mirror. Now there is a technique for you to use the mirror that's not fogged. You can dip it in hot water and pass it with running water to ensure it's not too hot for your patient. You can use that so it will be clear and not fogged. Now for the 3 facial photos, it should be 1 frontal smiling, 1 frontal not smiling, and 1 side profile. If your patient's hair is long, make sure to tuck it behind the ear. And lastly, 2 radiographs, the panoramic X-ray and the cephalometric X-ray. We will be submitting this to the Smartee cases management. So the Smartee doctors will be having their own account and they will be submitting the data here. Once you have submitted the data, by the way, you will also have to answer the prescription page. So once you have submitted those data as well as the prescription page, then Smartee will be doing the treatment planning. They will release a 3D animation or simulation based on the doctor's prescription. They will check first, before they release the animation, the model and the intraoral photo. They will do analysis on them, making sure that the animation is very similar from the photos and the model cast. They will do digital model measurement, and they will also be using their self-developed cephalometric X-ray software. They will be using their self-developed cephalometric analysis software. And the reason why they need all these data, especially the OPG or the panoramic X-ray, is because they will be checking on the condition of the teeth. They will check if there's periapical lesion or if there is low bone level. Of course, we will be moving teeth. We have to treat it first, before we start using Smartee. They will be able to see if there's impaction. And what's good is because they will be giving feedback whenever they see that from the submission. After which they will do teeth segmentation, wherein they will divide the gum and the teeth using the software. And they will be releasing the 3D animation design, wherein tooth movement accuracy is up to 1 micrometer. They use plan requirements and orthodontic principles and design regulations. So once the doctor receives this animation, they will have to review it, check the target position and overall treatment stages. They will have to check also the movement table. There's the movement table at the bottom, and they can view the menu at the top. Now, the feature of this is that it also has this URL. You can actually share this animation with a patient using this link. Just click on the URL and this link will be copied. You can share this with your patient. Now, on the right side, there's doctor control, wherein you will be able to place your comments if you need to modify the design. There's also the staging, wherein you will be able to see the amount of movement per stage and per tooth. If it's light pink, it shows light movement. If it's dark pink, it shows moderate movement. And the black shows heavy movement. Now, you will also be able to check on the menu, the attachment for the IPR, the grid. There's also the measurement for the overjet and overbite. Bolton analysis is also shown on the upper menu. What initially Smartee will be releasing is the target position. So when you receive an email from Smartee saying that the target position is released, it will only show the before and after. So that's 0 and 1. And then usually within the day or the day after, they will be releasing the animation staging. So the animation staging will show the number of aligners that the patient should be wearing, and also the movement of the teeth. So this is the player bar at the bottom. You can click that to see the animation or movement of the teeth. And this is the 3D animation modification. In the event that you find it hard to place your comments, then you can just modify it by using the 3D controls. You can move the teeth and send it to Smartee. Now, if you are satisfied already with the animation, that is the time that you discuss this with your patient. And once both you and your patient approves it, then the production of the clear aligner starts. So how do they produce these clear aligners? First, they do the 3D printing. They do the layout, the 3D print, model trim, UV cure, do the inspection, and do wax filling. And it also has the laser marking or a laminate with the number of stages on top, because each aligners come in packets for each set, for each stage. And it comes with a number of the aligner on the packet. In case your patient loses it, at least there's a laser number on top of the aligner so that they would know what aligner number are they on. Now, when they do this, they make sure it's precise, it's refined, and it's constantly improving. It also passes through cleaning, ultrasonic cleaning with disinfection before they do the packaging and send it to us. But before that, it also passes through quality inspection to check its appearance, its attachment, trim line, and they will deliver already the product to us. Now, once the doctor receives this, it comes with the aligner case for the patient. It also comes with the extractor tool and the chewies. It also comes with a treatment overview, so the doctor is guided step by step on what to do. For example, before step 1, if ever that your patient needs to do extraction, then you have to do it first before putting on the first aligner. If you need to add attachment or place orthodontic button, it will also be indicated. Now, for adding attachment, you will be given a template so that you'll be able to attach it on the patient's teeth. For step 13, it shows IPR, so you just have to follow step by step on what to do. You have a special notes also on the right side. So you are guided on what to observe during the treatment. It also comes with the attachment drawing for the attachment, so you are guided on where to place it, as well as the IPR drawing. So how do you start with IPR? These are the things that you need. You need an IPR gauge, you need an IPR burr, and an IPR strip or a diamond strip. Now for the bonding attachment, you need material similar to what you prepare for composite filling. You need a composite material, you need a light cure, you need an etchant, and you also need a bonding agent. Now, what is IPR? IPR is intraproximal reduction to mechanically remove enamel of the adjacent part of the teeth. Now, the purpose is to reconstruct or shape of contact area. It is one of the methods of alignment to correct the rotation. In the event that your patient or the doctor doesn't want any extraction for their patient, then IPR will be recommended. This is how you do it. If the IPR or the reduction is only around 0.1 to 0.2, make use of the diamond strip and make sure that you check using the IPR gauge to ensure that you're on the right size. Now, if it's about 0.3 to 0.5 millimeters reduction, make use of the IPR burr, or if you have a disc that is pre-measured already or an oscillating disc, please make use of that instead. Now, key points for IPR operation, you always have to start from the labial side all the way to the lingual side, and you have to do it gradually. Always make sure to maintain the original morphology of the tooth, avoiding any gingival shoulder. And if ever that there is a gingival shoulder that you have created, check with a floss. Always check with a floss, and if there is a shoulder that was left or a gingival shoulder created, just trim that using the diamond strip. Since we are removing enamel during the IPR process, then we have to place a Durafat or any fluoride treatment after. Now the attachment looks like this one. It is made of light curing resin made by the attachment templates. So you will be given attachment template wherein you will be placing the composite there, put it on the patient's teeth, light cure, and then this will be left on the patient's teeth. It is formed bonded resin on the tooth. Now we need to understand what are the function of each attachments and how do they move teeth. Primarily, it is good for aligner retention, but it also assists in teeth movement. If ever on your design or on the animation that you have received, you see an ellipsoid attachment, its function is to optimize for molar segment retention. That is for your aligners to avoid getting loose. So looking at the animation scheme, it was placed on the posterior teeth, and this is the after treatment result. If ever you see a bite pads attachment, that is to correct the cross bite in case of scissors bite and to unlock your bite to prevent occlusal trauma. So in this case, it was placed on the lower posterior teeth to avoid occlusal trauma before the treatment and then after the treatment. If it's a window attachment, That is for teeth elongation. So as shown below, you'll be able to see that the open bite was corrected because these window attachments were placed. The precision control attachment is for anterior root control and long distance canines translation. So you will see two attachments, one near the incisal or the occlusal area and one on the gingival area. The next is the vertical rectangular attachment. There are two functions for the vertical rectangular attachment. One is to correct the rotation or for root control. Looking at the sample below, it was placed beside the central incisors. And the second function of the vertical rectangular attachment is for anchorage enhancement, especially if we need to correct cases with tooth extraction. And for distalizing the teeth, this will be a great advantage. For the horizontal rectangular attachment, that is for molar tipping and extrusion. So when the crown is mesially tipped, we place the horizontal rectangular attachment on the buccal mesial side. The iris attachment is also an intrusion attachment. It assists in intruding the anterior teeth, whereas the bite plane attachment assists in unlocking the anterior bite in case of deep overbite. And if fused together, it can actually solve or it can treat the anterior deep bite of the patient. So here's the process before attachment bonding. You will be receiving templates. Template for the acid etchant and a template for the composite. Check using the attachment template if it fits well with the patient. Set it aside, and then you have to brush the teeth of the patient using the polishing brush and the polishing paste. And then you have to make sure that the teeth are dry. Of course, it's also important that you use an obtrugate or a cheek retractor so that we are sure that the teeth are not contaminated with saliva. Now you put on the template for the etchant. Now that etchant template is concentrated only where you will be placing the attachments. And then you have to etch it for 30 seconds each tooth. You have to wash it, dry, remove the template of the etchant template, and you have to place on the bonding. You have to bond the teeth for 10 seconds using the light cure machine, and you can already place on the attachment template with the composite on. Now, one advice or tip is to prepare it ahead of time because it's quite difficult or quite tedious to place the composite while the patient's mouth is dry. You prepare it at least 30 minutes or 30 minutes before the patient arrives. Just make sure that it's not lighted, or you have to just keep it inside the box of your Smartee box. Cure that for 20 seconds each after placing the attachment template. Once it is cured for 20 seconds, you remove the attachment template and cure it again for 20 seconds each. Now, we can't help sometimes that there are flashes or excess whenever we place it. Make sure to remove the excess, do not damage the four sides of the attachment, and do not scratch the tooth surface. You can polish it after removing the excess. And then you can already fit the aligners by making sure that the incisal edge and gingival margins are in the right position. Each time that the patient wears the aligner, you have to make them use the chewies. Okay? They have to chew on it for a few seconds to make sure that the aligners will fit well. And then you also have to teach the patient how to remove it using the extractor tool. So the technique there is to access it from the inside. It's better that they access it from the posterior teeth, upper palatal, or for the lower, from the lingual side, lift it from one side and then lift to the other side and then gently pull it. So after you have given the aligners to the patient, the doctor should instruct their patients in detail on how to wear and remove the aligners correctly, and also set proper expectation with them, schedule for their next visit, and remind them that patient compliance is crucial to achieve an ideal treatment outcome. Now, we already know how to submit the case to Smartee. We need the x-rays, right? We need also the photos. But it is different if we will be submitting a case using the GS. So these are the list of patient records to be submitted in cases of mandibular repositioning. Because using the GS, the Smartee GS, mandibular repositioning, we need the photos, original photos before and after the mandibular repositioning. We also need OPG, or the panoramic X-ray, the cephalometric X-ray. And for those patients with mandibular deviation, we need a frontal cephalogram. Now, this is quite a bit complicated if we will be submitting a case for GS, because we need to classify our patient first. Now, for Smartee GS, if it is non-protruding teeth with a prominent bone for class 2 cases with deep overjet, shallow overbite, and shallow curve of Spee. So it means it's skeletally originated. That is the classification made by Professor Shen Gan. We need to know the classification for us to know how to submit the data for the Smartee GS. Now, if it is a protruding teeth with mandibular retrusion, with deep overjet and deep overbite with deep curve of Spee, that is called mandibular positioning originated. If it's non-protruding teeth with prominent bone and mandibular retrusion, also with deep overjet, deep overbite, and deep curve of Spee, then it's called combined subtype 1. For retrusive teeth with prominent bone and with mandibular retrusion, that's called combined subtype 2. Now, in submitting an STL file for a reposition mandible, you have to prepare a wax pattern. So with a thickness of 5 to 6 millimeters, and you have to have a full coverage of the posterior teeth with low coverage of the anterior teeth. You can cut only up to 3 to 3 or 4 to 4 section of the teeth. And then we can scan once we are able to get the correct bite of the patient. Now, there's a principle to follow for the sagittal direction. We've talked about the mandibular positioning originated. If that is the case of your patient with deep overbite, deep overjet, and deep curve of Spee, with non-protruding teeth but prominent, with protruding teeth and mandibular retrusion, then we will have to make sure that when we take the bite, the mandibular incisors are behind the maxillary incisors by 1 to 2 millimeters. Okay, that's for sagittal direction. But if it's a combined subtype 1, we have to advance the mandible to the position where the upper and lower teeth line up edge to edge. Again, what is combined subtype 1? That is for non-protruding teeth with a prominent bone and with mandibular retrusion. So it has to be an edge to edge when we take the bite of the patient. Now, if it's a combined subtype 2, meaning to say that it's a retrusive with a prominent bone and mandibular retrusion, then you have to do this. Mandibular incisor should be ahead of the maxillary incisors by 1 to 2 millimeters whenever we take the bite. We also have to follow this principle for horizontal direction whenever we take the bite for GS. We have to coordinate the midline of the maxillary and mandibular anterior teeth as well as the chin point with the facial midline. So if the teeth midline is obviously out of the alignment with the jaw midline, the facial midline shall prevail. As for the vertical direction, if it's less than 4 millimeters, the anterior teeth should be open vertically by 1 to 2 millimeters because the correct height for the posterior should be around 4 to 5 millimeters. So if we see a sample here, it's not enough then we need to increase the bite or open vertically for the anterior teeth by 1 to 2 millimeters before you take the bite. So if the posterior bite reaches 4 to 5 millimeters already, then you don't have to open the anterior vertically. So we will be submitting a before and after bite of the patient, as well as the facial photos before and after the mandibular repositioning. So that's how we take the bite of the patient. And that ends my lecture for this evening. Thank you so much for your time. Yeah. So I see there's a question here. Does root visualization feature show true roots from CBCT or fake roots from the algorithm? So this root visualization will show that there is no risk for dehiscence or bone or fenestration. It's asked if it's a fake root from the algorithm. No, it shows the same. It's like in the absence of CBCT. So they will be able to show you the root with the root visualization. So somehow you'll be able to see if there's risk of fenestration with the bone. How much is Smartee?
Right.
Well, it depends on your location, because for sure you have distributor in your area, and you can ask who is the distributor in your area for the price. But what I can tell you is that their price is very competitive, you know, with the package that they have that includes refinement. So it's a very good price for the doctor and your patient.
Yeah, it really depends.
It really depends, yeah, from what area are you on. There's a question here. Thank you. I have class 2 case, but it is my first case. How do I know that I did my bite registration right where you told us? Right. So class 2 cases, it depends if there is a prominent bone involved or skeletal, right? If there's deep curve of SPE, deep overbite and deep overjet, and you want to improve on the facial profile of your patient, then Smartee GS is the best choice for your patient. But even class 2 cases can be treated by GE or even alpha. So you still need to classify what kind of class 2 case that you have. Now, if ever that your case is for GS, then you have to classify if there's bony protrusion, retrusive mandible, then you have to make sure that you are getting the correct bite, like what I have mentioned earlier. Edge-to-edge bite or behind the incisors, maxillary incisors. So it really depends. Just have to make sure that the facial profile of your patient, that is the same as what you would want to see for the result.
Thanks, Dr. Chris.
So,
and one more. How can we reach this portal?
Yes. So this portal, again, it depends on which country are you. You have to ask also your provider, whoever is the distributor of Smartee in your area. As for us in the Philippines, we are providing this portal to our patients whenever they have undergone training from us, because we want to ensure that the doctors who will be using Smartee are all trained, and then we will be giving them access to the portal. But I guess for other countries, it's the distributor who gives them access to this portal. Is that right, Fiona?
Yeah, exactly.
Yeah, because we want to ensure that all of you are equipped with knowledge on how to start the treatment with your patients.
Yeah, right. And Dr. Chris, there's one question and about in the chat box says, I would appreciate if we can find this information on the website.
Okay. So this information, Fiona can answer this. Do we already have, a website for all countries?
Yeah, sure. Exactly. We have a few social media accounts, and I think you can find useful information on them, like Instagram and Facebook, LinkedIn, and also our official website, smartee.uk.
Yeah, we also have this. So the information are there, right? Also, in YouTube, you can search on the S8. Yeah, so these are the YouTube, LinkedIn, and IG, and Facebook account as well.
Yes, there are informative videos on our YouTube channel about our products from S1 to S20. And also
So
our product. Yeah.
That's right. Smartee has different products to choose from so that you know which one is suitable for your patient.
Exactly.
Thank you.
And so there's one question, Dr. Chris, about could you share this presentation? You mean the slides?
I guess, yes, we can actually share this information to them so that somehow they would know how to start to use the Smartee. But it would be best if you also get this information from your local distributor, because I'm sure they also have this information.
Yeah, exactly. And if you visit our YouTube channel, this course will be on our channel in a few days as well.
Right.
One more question, Dr. Sorry.
Yeah, go ahead.
Yeah, one more question in the Q&A section. So we got one doctor asks, for the skeletal class 2 growing patient treatment with returned mandible, do we wait until all his permanent teeth fall erupted, or can we use it during late mixed dentition?
Yeah, for using the GS, you can already use it. You don't have to wait until all the permanent teeth are fully erupted. That is the reason why there is refinement for every package, because we are waiting for the growth, right? Especially for those patients with mixed dentition. And after, because we call it phasing. Once we are done with the phase, then we can already shift to the second phase. And we can do refinement. For example, for Infinity, we have unlimited refinement. And why is that? Unlimited refinement within 5 years. Why is that? Because we can apply that for growing patients. So that is unlimited refinement for that patient, because we cannot help it that, for example, we have a teenager patient or a 12-year-old, 13-year-old patient. Suddenly the molars are erupting or the premolars are erupting, then suddenly it changes the treatment plan. Then make use of the refinement so that we can fix the issue or the problem.
Thanks. All right. One more question from Song in the Q&A section, Dr. Chris. How can I watch this video later? Okay, so it will be on our YouTube channel. You can see our account in the chat box called Smartee Clear Aligner. Okay, yeah.
If you have any questions, we also have, our Smartee, Smartee FB page in the Philippines. So if you have, simple questions, then you can ask them, and we'll be happy to respond to whatever question that they have. But again, it depends on your distributor for Smartee. It would be best to inquire from your local distributor. Let me just add, because there's a question about the skeletal class 2 growing patient treatment, right? We have ongoing webinars or lectures for Smartee, especially for skeletal class 2, right? For the GS. So it would be best to catch our upcoming webinars to learn more about that technique or technology. Yeah, thank you. Thank you, everyone, for your time. And thank you, Fiona.
Okay, thank you, Dr. Chris. You
Bye-bye.
too. All right, so thanks everyone for joining with us today. All right, so let me just share my screen for a little minute. At last, so please join me to thank Dr. Chris for her excellent lecture, and thank you for joining today's webinar. I hope you find this session insightful and helpful to your clinical practice. But before we finish today, I'd like to take one more minute to take you through our upcoming webinar sessions, including our lecturers and the topics we will cover in the future. So please follow us on social media such as Facebook, YouTube, Instagram, and LinkedIn for the latest information on our webinar in the coming next few months. So, right, this is all for today. And once again, I'd like to thank Dr. Chris for the lecture today, and thank you for taking your time in joining us and your continued support to Smartee. So enjoy the rest of your day and night, everyone. We look forward to seeing you at our next session. Goodbye, everyone. Thank you, Dr. Chris.
Goodbye. Thank you as well. Thank you, everyone. Bye.
Bye.